Physical exam of an infant shows clitoromegaly and partial fusion of the labioscrotal folds. Cytogenic analysis reveals a 46XX karyotype. Abdominal imaging shows bilateral adrenal hyperplasia. This patient is most likely deficient for an enzyme normally responsible for which of the following reactions? Now, there's going to be two important things that is going to give us the diagnosis. One is going to be the ambiguous genitalia, underlined here, and the second clue is going to be the imaging that shows the bilateral adrenal hyperplasia. So these findings are going to be consistent with congenital adrenal hyperplasia, which is most commonly caused by a 21 hydroxylase deficiency. Around 90% of the cases of congenital adrenal hyperplasia is going to be caused by a 21 hydroxylase deficiency. Now remember that the adrenal cortex is going to be made up of three layers: the zona glomerulosa, the zona fasciculata, and the zona reticularis. So 21 hydroxylase is going to be an enzyme that is going to be responsible for converting progesterone to 11-deoxycorticosterone in the zona glomerulosa. It is also going to be responsible for converting 17-hydroxyprogesterone to 11-deoxycortisol in the zona fasciculata. So if we have a deficiency in this enzyme, we ultimately lose the ability to produce aldosterone and cortisol. And as a result, the precursors to aldosterone and cortisol are going to shift to the zona reticularis, where we're going to be producing androgens. And so this is why females, when they're born, they're going to have an ambiguous genitalia. It's because of the excessive production of androgens. Now remember that aldosterone and cortisol are going to be important regulators of blood pressure. So as a result, this can lead to adrenal crisis where patients can have severe hypotension. So I have some mnemonics that might help you remember the functions of 21 hydroxylase. So what I like to imagine is a 21-year-old college student just doing shocking things. And the shock is going to help me remember that there's going to be low aldosterone and low cortisol that can cause a shock. Now, 21-year-olds also have high testosterone levels. They're college age students. They have a lot of testosterone. So this is going to help me remember the fact that 21 hydroxylase deficiency is going to cause high levels of androgens. So remember that cortisol has a negative feedback on GnRH, CRH, and ACTH. So because in 21 hydroxylase deficiency we have low levels of cortisol, we're not going to have this negative feedback. As a result, ACTH levels are going to be increased. And so this is why we have hyperplasia of the adrenal glands, is because we have excessive amounts of ACTH stimulating the adrenal glands. And so that causes hypertrophy. And so this is another way in which we're going to be producing androgens, is because ACTH is not only going to stimulate the zona fasciculata, but also the zona reticularis in the adrenal cortex. So we not only get production of excessive androgens from precursors to cortisol and aldosterone, but also because we have high levels of ACTH that is going to stimulate the zona reticularis to produce more androgens. Diagnosis of 21 hydroxylase deficiency is going to be made by high levels of 17-hydroxyprogesterone, and this is also important to know. And to answer our question, if you go back, the answer is going to be answer choice C, which is going to be the conversion of progesterone to 11-deoxycorticosterone is going to be hindered, because remember that 21 hydroxylase was going to be also mediating this reaction. So in the zona glomerulosa, we have the conversion of progesterone to 11-deoxycortisone by 21 hydroxylase. So the answer is going to be answer choice C.